Welcome back, Brianna and Jared. We're so happy to have you again. So for those of you that missed last week or just need a little refresher, Brianna and Jared are both second-year med students at the Donald and Barbara Zucker School of Medicine at Hofstra University. And I will let them tell you a little bit more about themselves and what they're up to right now.
Thanks so much. Okay, I'm gonna share some slides. Do you guys see that?
Yes.
All right, so we are Brianna Donnelly and Jared Bassett, and we know that, like we said, a lot of people are returning. So we're gonna keep this short and we're gonna leave most of the time open for you guys to ask questions about anything you want. Medical school, pre-med, research, anything. So first, though, I'll give you a bit of context in case you missed it last week. I'm going into my second year of medical school, as is Jared, and my background consisted of in high school, I knew I kind of was interested in medicine, so I shadowed a whole bunch of physicians, and I shadowed a lot of different neurologists, and then I shadowed a craniotomy, and I decided that I wanted to go into neurosurgery. So I applied for 4+4 BSMD programs around the country. And basically, what that means is that instead of applying for medical school in the traditional application cycle, in my junior or senior year of college, I applied in high school and I did my interviews then. And so I decided eventually to go to the Hofstra 4+4 program. So I went to Hofstra for my undergrad, and then I graduated a year and a half early, and I went to Buffalo to do research full time, doing endovascular neurosurgery research at UB Neurosurgery. And then after a year and a half there, I came right to Hofstra Med School, and I started here. I've been doing research with the Northwell department with Dr. D'Amico, and it's been really fun so far. And we'll talk a little bit more about my first year later.
Awesome. Hi, everyone. If we didn't meet last week, my name is Jared. I am also an incoming second-year medical student at Zucker. I guess in terms of what brought me into medicine, I was always very interested in medicine. I was sort of one of those people that knew they wanted to go into medicine at a young age. For me, I was very interested in cancer and oncology and that side of medicine. I suffered a neck injury when I was in high school that got me interested in neuroscience. And I sort of took those two passions of oncology and neuroscience and ended up working in a lab, or I guess volunteering in a lab, doing research in a lab in high school, focused on neuro-oncology, pediatric neuro-oncology. And in that process, I had the opportunity to shadow the PIs of those labs, being pediatric neurosurgeons in New York City. And that's what really got me excited about not only medicine, but really about neurosurgery as a field in general. And so fast forward, I ended up attending the University of Pennsylvania. There, I sort of took a hiatus from neurosurgery and started exploring other fields. I worked in a pancreatic cancer lab. I shadowed a lot of GI doctors and pancreatic cancer surgeons and things like that. I didn't love it as much as the neurosurgical field, I guess, for me. But I ended up applying to medical school. I took one gap year. During that gap year, I worked at a pharmaceutical company where I continued pancreatic cancer research as part of their pre-therapeutic pipeline. So actually working with some of our investigational drugs before they were FDA approved or before they started clinical trials. And then fast forward, I'm here now with Brianna. We just finished up our first year of medical school. We're on our summer break, but this is a time for us to really get engaged with research. So Brianna and I have been, lucky enough to be very involved with the neurosurgery department, getting involved with different skills sessions and learning how to do certain procedures and getting to go into the ORs and scrub on cases and do research with the department. It's been such an invaluable experience. So yeah. Cool. So in terms of our experience, in MS1, and I think most of this, we're going to really just open it up for Q&A. But I guess to give you an idea for those that aren't aware about medical school and what comes with being a medical student, there is a really nice, I guess, separation of didactic medicine being like what you learn in the classroom, what you're learning on a day-to-day from reading, from hearing lectures, from working with other students. And then the clinical side of medicine being like actually working with patients and learning these skills and learning how to do a full physical exam and learning how to report your results to attendings. And so, for us, the first year of medical school was very, very loaded with that didactic side of things. We've learned, I think, almost 70% of what you need to know for step one, which is a significant amount of material. And that's the board exams you take if you're not familiar at the end of your second year. And on top of that, in our school, we prioritize patient interaction and early clinical exposure. And so a big thing for us was actually getting into the clinic and working with patients and doing full physical exams and getting full histories and generating differential diagnoses. And so Brianna, knows well as I do, our school prioritizes those things. And so in the first 8 weeks of being a student at the Zucker School of Medicine, we not only get certified as EMTs, which is a very cool, unique program at our school, but we learn the entire physical exam. We learn how to take an entire patient history. And so when we're actually in the clinic and in the wards, by the time January hit, I feel like we were able to generate our own diagnoses from what we knew and do full physicals and see patients without an attending. So I think it's a really unbelievable experience. I think, for those who are undergrads and those who are in high school, like getting your feet wet and getting out there and trying to explore the field of medicine, I think is a critical component of, seeing if this is the career path for you. But overall, medical school is a lot of fun. It is a lot of work, and you're going to learn a lot, but it is definitely a really amazing experience. So I'll pass it on to Brianna.
Yeah, those were great points. And I just maybe will add a few more things, but you guys can start putting questions in the chat if you want, and we'll answer them right after this. I would just say a few more things to consider when you're picking a med school are whether it's pass fail, whether it's in person or mostly remote, and how often the exams are. Those are all important things to look at with medical schools because it's all different. There's also different kinds of med schools. We didn't really talk about that last week. Maybe that's something we can touch on. There's MD schools, DO schools, there's schools in the Caribbean, schools abroad. So lots of options. And also with like a work-life balance, like I said last week, there is time in medical school to have fun with your friends, to continue your hobbies. And so it's not like you're giving up everything once you start medical school. You still have time to be yourself and do what you want to do. So I don't really have much else to add. I think we should start answering questions. Does that sound good, Jared?
Yeah.
Okay.
Works.
Alrighty.
Yeah, if you guys want, I'm gonna be writing out the questions and Samantha's gonna kind of ask y'all them just so that way we can make sure that there's sort of an organization to it. So
Okay.
if you want to stop sharing your screen, that way everybody can kind of just see you.
Yeah.
All right. I'm gonna get
Great.
first.
Get started. So the first question for you guys is, how much free time do you get after MS1 and ZSOM for summer research experiences?
So in the first summer, we get off in the beginning of June and we have until the end of August. So I guess it's like 3 full months, which is really nice. That's kind of like almost longer than college. No, it's not longer than college, but it feels like a long time. And yeah, almost all of our students are doing research this summer. We all get a summer research check for doing research at Northwell, which is a nice little stipend.
Yeah.
Cool. How much time did pre-med and med school applications take? How did you balance it with the rest of college courses and extracurriculars?
So that's a good question. I think it varies from school to school. My understanding is if you're pre-med, and so when I was in undergrad, pre-med was a track, but it was, and by that I mean it wasn't a major, like it wasn't something you can like major in. Like I studied pre-med in college. It was one of those things that you would like. I studied biology, and some of the courses I took for my biology major counted for pre-med requirements. And so there were other courses you had to take. Like I didn't necessarily need to take physics for my biology major, but pre-med wanted that. So you know, in terms of the overlap between pre-med and my normal undergraduate studies, I would say they were very overlapped. I think a lot of times, if you are interested in medicine and you're pursuing a pre-medical track, the courses you're going to be taking outside of your, I guess, gen ed requirements that you're going to have are going to be for pre-med or in some capacity related. So I didn't feel like it required additional time on top of the coursework itself. Now, obviously, you know, some of the things you do as a pre-med are going to be volunteering, engaging with patients. So whether that's volunteering at a hospital or with, you know, a service organization, working as an EMT, those are things students like to do. So clinical exposure. A lot of students get involved with research as an undergrad. So those are things you have to sort of find time for. But my perspective, and Brianna, you can also, you know, comment on this too, but I found like most of my friends who were pre-med in college or in undergrad didn't really have too much difficulty with that, balancing, you know, the extracurricular pre-med activities with their day-to-day life. I think you actually have a lot of free time as an undergrad, so enjoy that while you have it. Yeah, and then I don't know, what was the second part of the question? Applications? I don't know, Brianna, take that.
Yeah, how much time did your applications take?
I can't comment on applications. That was a 4+4, so I'll let Jared take that one.
Sorry. So the application process for medical school is about a year long, which means that if you are interested in going straight through from college to medical school, you need to apply at the end of your junior summer going into your senior year, because you're going to interview all throughout your senior year. Because I took a gap year, that meant I applied after I graduated college, and then I had a year to work. And during that year, I was doing my interviews. So in terms of how much time it takes, the MCAT is obviously a big part of your application process. I took that my senior year of college spring. That takes time for me. I studied for maybe 4 months, 4 months. The first month was kind of like washy, and then the rest of it was full swing ahead. So that takes time. The MCAT for me was like the biggest time consuming component. Then the actual process of writing your primary application, which is your like, why do you want to be a doctor essay, and your grades and your activities and what's your most meaningful experience. Those take time, but you know, I guess they say try and pre-write it. For me, I spent like 3 weeks maybe preparing that. Secondary applications take the longest. That's every school asking you to answer their own questions. There's a lot of overlap sometimes, but you know, those take time. So you know, you want to try and get them done as quickly as possible and turn them back in as quickly as possible to show you're interested in the school. But you know, you can only do so much and type as fast as possible, and you don't want to send something that's bad. So you take your time. So I think that took me about a month and a half to get all my secondaries back out. And then interviews are sort of like sporadic. They come, sometimes they don't come. Hopefully they come. But that sort of lasts anywhere from like right when you submit your application in June, July, August, to like all the way through to March, April, May the following year. So it can be a long, lengthy process, and you sort of just have to keep your head high and stay off the message boards and just think about, you know, yourself.
Great.
Yeah.
Thank you. So the next question that we have for you guys is, what is the best advice that you would give to rising seniors in high school, programs to get involved in, things to look out for, how to get ahead, that kind of stuff? And also, what kinds of extracurriculars or experiences did you both have in high school?
I would say for rising seniors, I would really take a look at the 4+4 and 3+4 programs, because if you can get into one of those and you don't have to worry about interviewing and applying later on, you're going to save not only a ton of time, but a ton of money down the road on applications and traveling for interviews. We have one at Hofstra. That's the one that I was in. So it's called the Hofstra 4+4 BA MD program. I definitely look into it. But besides those kinds of direct admission programs, I was in music, orchestra, you know, I had like summer jobs, actually, something like kind of funny, when I was in my 4+4 interview at Hofstra, they talked to me a lot about my summer job at an ice cream shop. They're like, what's your favorite flavor? Like kind of just like trying to see if you have like stories and a personality and like you can just talk to anyone kind of thing. So yeah, that would be what I would say.
Yeah, I think Brianna brings up a good point. When you go on interviews and you're interested, or you're applying to medical school, and even when you apply to college, a lot of people who are applying to the schools have very similar like checkbox things. Everyone who applies to med school did some volunteering, and everyone who applied to med school, most people probably did some research. And so what they want to see is like, what makes you you? What hobbies do you have? What makes you interesting? What makes you a good person to work with? With obviously the caveat being you have to have done the things you need to do to get into med school. They want to also see what really makes you you. So, Brianna gave a good example of them, interviewing her on her ice cream job. So I know for me, like they loved asking me about, I don't know, random things like my traveling experiences, stuff like that. I was a DJ when I was in college. So my medical school admissions, interviewers, a lot of times they would like hone in on that and ask me a lot about like what it was like doing that. So, things like that. I would say just like hold true to your hobbies. And yeah, I'm trying to think what else. Tips, I guess, things I was involved in high school. I was involved in a bunch of random stuff. I did like the student government. I did like Model UN, mock trial. I did research in the summers, like I mentioned earlier, volunteered. Yeah, I would say that was about it. I think it was in college when I really started like honing in on the pre-medical activities and like really working at a hospital and working for nonprofits and things like that. I think that's where I started doing that. But yeah, stay true to yourself and definitely like get started with those extracurriculars early, like in college, for pre-med if you know you want to do it. And definitely take Brianna's advice, look into those BAMD programs. While I love being here, like it would have been nice to just not have to worry about all the medical school application processes, and do the 4+4s. I think this 3+4s also. I know GW has one, BU has one, Brown has one. So there's a bunch of schools you can look into that have them. So, and I think sometimes they even give you a little of a financial incentive too if you get in, from what I understood. Don't quote me on that.
Amazing, thank you. So this question is a little bit more for Brianna because it is about the 4+4 program. Someone asked how big of a commitment is this program if you're not entirely certain that you want to become a doctor?
Yeah, so I would say, oops, sorry. I would say that if you're not entirely sure, it might be better to apply like for regular pre-med admissions because they do only take 10 people. And I know like a lot of people apply and it's highly discouraged from leaving the program once you're in it. You certainly can leave it, and I think there are people in our program who have in the past. But in my class, all 10 of us that, got in, we went through for medical school. And that's how they really want it to be because they're taking a chance on you basically. In terms of like commitment, you just have to do your regular pre-med requirements in college. And we had a pre-med advisor actually at the medical school who we met with quarterly to make sure that we were filling our requirements for the program. So you do keep in touch with the medical school. There is some connection during the pre-med part. And like we were talking about before, for me it was a little different because my major was like literally called pre-med and I just had to do the pre-med requirements. I didn't like do any other classes in college besides a couple that I wanted to do, like orchestra, and I did self-defense, which was fun. So yeah, I would say if you're not entirely sure, maybe do a little bit of shadowing and then you can try to apply for these programs, but it might be better to go through the regular pre-med route.
Perfect, thank you. So the next question that we have is, what does Hofstra provide for medical students equipment-wise? I heard many schools give out laptops, stethoscopes, etc.
Yeah, I think every student across the board gets access. We get a stethoscope, tuning forks, reflex hammers, scrubs for structure lab, and then I don't know, everything, EMT uniforms.
Yeah, we got Patagonias. of a
Patagonias. Yeah, we do get some merch every year. A fantastic education. Um, Other than that, in terms of like laptops and like that sort of thing, I don't think like the school provides that. Like I think if they make exceptions for students, I think who can't get access to things. They have a really nice like financial aid department that works with students in cases of like emergency, to get them access to things. I know, for me, like I was able to like borrow a laptop while my laptop was getting fixed for a period of time. So, that stuff's available to students. But I don't think they just like give out, like, I don't think that's something that they provide to all students.
Yeah, I know some med schools do iPads, or I know Rochester does free ultrasound plugins for the phone, which is like so
The
cool.
butterflies.
Yeah, I kind of want one of those.
Our machines are
But
different.
what?
So at the Zucker School of Medicine, we actually get trained very well in ultrasound technology. So we actually do a lot of ultrasonography, I guess, unlike any other school in the country. So that is like very integrated. We do it once a week in our curriculum, constantly exploring anatomy. And then in our third years, we actually get asked all the time to go like do full ultrasounds, come up with reports, and report back to the attending. So we're very well trained in ultrasound. So Brianna was talking about the butterfly ultrasounds are like little iPad plugins. We actually get like big machine ultrasounds. Can't take them home, but they're available to us for use throughout the day. So that's what I was talking about.
Yeah, that's true. And it's like Jared was saying, it's part of our curriculum, completely integrated. On our exams, actually, we like have to go into a room and there's a patient and they say, my leg hurts. Can you give me an ultrasound? The doctor said you'd give me an ultrasound. So, and then you have to do an ultrasound and tell them what you find. It's fun once you get the training and you feel comfortable with it. It's a lot of fun.
Awesome. Thank you, guys. So the next question that we have for the both of you is, can you guide a little more about research, specifically the research writing part?
Yeah. So when I write, a lot of the times I'll spend a lot of time reading before I start writing. I think, I usually start with results if I have the data, which you probably, do if you're writing a paper, you have the data done already. And then do results and methods first, and then I work backwards. I do intro and then discussion last, because you want to talk about your results and kind of work it in the discussion. The discussion is probably the hardest part to write. In terms of tools, I use Microsoft Copilot a lot. It's like ChatGPT, but I think it's a little bit more nuanced for writing. I don't ever take what it says and use that in my writing, because there are AI detectors now and journals will put it through and they'll see if you used it. But what I do is I'll say to Microsoft Copilot, I'll be like, write an essay about intravascular ultrasound for venous sinus stenting and cite your sources. And then I'll read what they wrote, and then I'll go to the papers that they cited, because sometimes it finds papers that I didn't find on PubMed. So yeah, I would just say if you use AI to help you write, just don't copy it. Just use it as a resource to help you learn before you write.
Yeah, for me, my writing, I think I definitely agree with Brianna. I always do discussion introduction last. I think you need to see if you actually have results before it's worthwhile to like write. One of the things I always was taught was have an ideal journal in mind that you want to submit to, so that you can, and Brianna and I both do clinical research. So the conversation is a little different when you're working in a lab and doing like bench work. So clinical research is more like doing like chart reviews and talking in like hindsight. Like we had like 30 patients we analyzed and we went through all their charts and we saw XYZ. When we write for those, you pick a target journal is what I was always taught. And so you can sort of like format it and design it in a way that speaks well to that journal. The other thing is some people do this. I've sort of go back and forth on it. You can read a lot up front and then like write your introduction, or you can like write your introduction and try and find sources that like match what you're saying. I don't think that's always the best idea, because sometimes it's just not a good idea to do that. But like sometimes if it's like a fact that you know for certain, like for example, venous sinus stenting opens up the the superior sagittal sinus or whatever, if it's a fact that is known and you just need a source to like back that up, that's something that like you can do like quickly. But like obviously you want to like be very well read. I think reading review papers is very helpful because they give you a lot of not only like concise explanations of what's happening in the field, but they also do a nice job at like citing their sources, so you can like use their sources to start crafting your own opinions as well. So I think that's sort of the advice I would give for writing. Clinical research is a lot quicker to do, in my opinion, than bench work. So that's just a piece of advice for those interested in doing more data analysis and writing and things like that. Like definitely look into clinical research opportunities. There's tons of them. You can always find them. Lab work takes a long time. It's very rewarding if you like it, but that requires a lot more, I guess, physical labor and effort to produce a publication. So just keep that in mind.
Great, thanks, guys. Next question. What was your personal essay about entering into college?
Let me think. Going into college, I I wrote it about I did some research in high school about the effects of music on the brain, and I used this I guess I'll describe my research. It was kind of like weird, but there's this Star Wars toy that uses EEG leads actually to like make you think like you have the force and you like can think and kind of like move things with your mind. It was a really cool toy. Anyways, I my friend helped me reprogram it so that instead of using it as a toy, we use it to actually like get the EEG outputs. And so I had my friends who were musicians take an SAT exam like while they were while I had the EEG on, and then I got the EEG outputs, and then I had another group of people who were not musicians do the same thing, and then I compared the results because I just wanted to see if there were like differences in the way that musicians think. So I wrote a lot of my stuff, and a lot of my interviews were about that research. And also I talked a little bit about like family experience I had while like related to neurosurgery because my cousin had a brain tumor, so I kind of like also talked about that a little bit. I think it is, I don't know, I'd like to hear maybe Jared's opinion on this, but I don't know if it's like everyone kind of writes about their family experiences in their college essays, like admissions essays. And I don't know if that's like a cliche, and I don't know if you should avoid it. I feel like whenever I talk to people, they talk about their family experience and then that's how they got into medicine. And I just don't know if it's like the admissions counselors have heard it over and over again. I don't know. Jared, what do you think?
You're talking about for medical school?
Yeah, like, or no, for I think these guys are talking about going into college.
For undergrad. Okay, so
yeah.
For college, the advice I would give would be don't write something cliche. Try and avoid cliche. Write something that's true to you. The big thing is I was always told like take some very small thing I experienced in life and then like extrapolate on it, like talk about how it impacted you as a person. That's what they really care about. Like, are you able to like self-reflect and think about an experience that helped change who you are or defines a specific characteristic you have. So for me, I actually talked about getting into an argument with a person on a train when I was in high school about universal healthcare. While like my three buddies were sitting to my like the next to me, we were going to the Rangers game in New York City, and I just decided to start arguing with this lady about universal healthcare, which I was. Whatever, regardless of my opinion, she ended up giving me a lot of really good pointers, and my whole essay ended up being really about how important it is to listen to other people and be open-minded and be willing to change and blah blah blah. And I use the whole train as a metaphor. If you've ever taken the Metro North or Long Island Railroad, like during rush hour, like nobody wants to talk, you're not supposed to talk, it's quiet. So like I talked about the idea of breaking the silence, blah blah blah. So you can get like creative with it, but for me, I think it's important when you write your essays to like find some small thing, some experience, and really just focus in on like how it made you who you are, and how it defines you as a person. I think that's really what they're looking for. Who are you as a person? Now for med school, yeah, it's a little different. I think most people have some sort of potentially, whether it's someone in your family or some experience you've had that got you interested in medicine. That's fine. Like that they understand that. But what the med school admissions people really want to know is like, why do you want to do it? You know, seeing it from your family, like I did mention in the beginning of my application essay, like I was interested in my grandfather's LVAD that he had on his heart. And it was that led me to do XYZ experiences that led me to build XYZ characteristics. So, you know, you could talk about it as like an introductory thing, but I think like, you know, don't just say like, it's because of my grandfather that I want to be a doctor. It's because of my grandfather I got these experiences that really showed me I want to be a doctor. That I think is the big thing.
Great, thank you guys. So next question. How do you feel your extracurriculars and lab internships have helped you throughout med school?
So for me, the lab experience, I guess, even though it wasn't a lab, it was clinical research, was the UB neurosurgery year and a half that I did. And I loved my time there. I thought it was amazing. And I mostly it was chart review and writing and being in an office and doing that kind of research that I did. But I worked closely with the residents and fellows, and I got to like hear a lot about the neurosurgery application process ahead of time before I started medical school, which was very useful for me. But I also got to go into the OR sometimes to collect data. We did one study that was a transcranial Doppler, but it was like a robotic transcranial Doppler, so we didn't have to find the windows. It was like a robot that did it. And so we'd go into the OR, we'd put on the head device, and I got to see a lot of different procedures, not only in the cath lab, endovascular procedures, but also open procedures in the OR. So that was very cool. So I would say taking that into medical school, I had a base knowledge of data collection and writing and doing reviews that helped me to transfer that into my research here at Northwell. So I think it was very helpful. If you can do something like that, if you can do a little bit of clinical research, even if it's just getting involved in one paper before you start medical school, not like that'll help you both with your application, and it'll just give you a taste of what you'll be doing in medical school. Because everyone does research in medical school. It's just you have to do it if you want to get into residency. So better to get good at it early.
Yeah, I didn't do any clinical research at all before coming to medical school, which I think I would have liked to have done. But it's very easy to get involved in clinical research and learn how to do it. I was all bench work. I did bench work in high school, college, and during my gap year. So I think for me, those lab internship experiences taught me how to be patient. I think that's a big thing that everyone should learn how to do. It also taught me a lot of critical skills about, you know, data generation, analyzing data, you know, being able to interpret data and draw conclusions from that data. I think those are like, you learn a lot of really critical skills. I didn't get as much writing experience because you really don't publish as many papers. You publish a couple very good papers, but it's like very infrequent. So I didn't get a lot of writing experience. So if that's what you're interested in, like definitely look into clinical research opportunities. But you know, working in labs was a good experience. I think like I got paid to work in them too, at least in college and definitely during my gap year. So that was also nice. You know, learning how to actually work a job and do evaluations and midterm feedback and, you know, talk about all that stuff. So you know, that's it's just life experience, I guess. That yeah, I would say.
Also, I guess I'll add on to that because you reminded me. There's a lot of gap year opportunities that are great, but they're not paid. And I would say like your time is valuable. You should get paid for your research. And it helps a lot in medical school. Like I'm so glad that I worked during my gap year. Because, you know, we're like adults now. We have rent and like bills. And so I would say, yeah, really prioritize the opportunities that are paid, or do an unpaid opportunity and have like a part-time job.
Great, thank you guys. What else do we have here? What would you say one of the most meaningful experiences that you have had that have shaped your medical school journey or your view regarding medicine?
That's a hard question.
That's a hard question. one of the, I guess, most meaningful things for me was doing those EMT shifts in our first few weeks of medical school. Um, that was like the first time I felt like I was really a part of the clinical side of medicine. And even though I didn't see anything that was crazy medically, like I just saw a lot of like chest pain with, I didn't have to, I know a lot of our classmates saw some really intense things, like people did CPR, they did um, things that were actually like intervening in someone's health. But those first two EMT shifts, I did one overnight in the city from Lenox Hill and another one in the daytime here on Long Island. They were just so cool, and interacting with the EMTs and paramedics and seeing the first responder side of medicine, which we don't usually see when we're in the hospital, was very, very cool.
Yeah, I would say for me, it's been really nice. Like as part of our, I guess, first year med school, we have what's called initial clinical experience in medicine. We do it initial clinical experience, and we do 15 medicine outpatient rotations. So we actually go to an outpatient clinic office, do patient histories, exams, all that stuff I was talking about. We do 5 in OB-GYN, and then we do 3 in surgery, all in the first year. And I wouldn't necessarily say, I guess I experienced this in all 3 of those areas, but one of the things I like really appreciated was how much, like, even as a medical student, you're involved in like being like a care provider. Like you are part of the care team. Like not only are you like, they always say like we're data gatherers as medical students, like we're there to just like ask people questions and get the information and then just like concisely tell the attendings. But you also like are involved in like coming up with decision-making processes, like coming up with treatment plans. And like a lot of times your word can inform patients' treatment. So I think that's one of the things I really appreciate was how collaborative the medical community really is. It's not like one doctor decides everything. Like there's doctors and nurses and ACPs and advanced care providers like PAs and nurse anesthetists and med students. And so you're really like all working together to like provide care for patients. I especially saw it inpatient, like during deliveries in my OB-GYN and like during the operating room when we were scrubbed in on our ortho cases. So, it's very collaborative, and that's something I didn't, I knew about before coming to medical school, but actually being part of like the care process and talking to, I'll talk to a nurse who will talk to a doctor, and the doctor will talk to me. It's like, it's really nice that exists. And I think that that's important because yeah, it's part of the process, I guess.
Awesome. Would you say that your studying techniques have changed since undergrad? If yes, how so?
I would say not really. I'm not a good example of somebody to follow. You should not procrastinate at all, but I do still. It's very hard to shake that for me, but I enjoy it, I guess. The way I study is I always make study guides for my exams. And in the process of making those study guides, like that's the way I study, like actively rewriting the notes and actively like coming up with cool picture designs. I sort of like can think about, as I'm taking the exam, like where in my study guide certain things were to like think about. And then I like use them like in the days leading up to the exam. But there are people who study with flashcards and it's called Anki. That's a big thing that a lot of people like using. So, everyone has a different approach, but my study habits didn't change. I think the nice thing for everyone is in your first couple of weeks of medical school, like the faculty know, like you haven't been in med school yet. Like there's a lot of material you're going to learn. So you have to find what works for you. And there's like definitely an acclimation period or like some time you have in the beginning of med school to like really figure out the study tips and tricks that work best for you. And I definitely encourage you to focus on that in your first couple of weeks of med school.
Yeah, my study techniques also didn't really change from undergrad. I always used the slides from the professor. I would annotate them, and then when I'm studying for the exam, I just go through the slides like maybe 2 passes. And that's the same thing I did in medical school. I am gonna try to use Anki this year because I think it helps you to not procrastinate. And yeah, because like when I use the slides, I kind of like I need that urgency. Like I need to know the exams in 1 week if I'm gonna actually like get down and really study. So I think Anki will help me keep on top of it. So yeah, that's something Anki you can use for the MCAT too. And I think I would have liked to do that because then I would have gotten used to it and I would have learned about all the tricks before getting into med school. So if you haven't taken MCAT yet, maybe try Anki. Use the decks that are online so that you can get used to that tool.
Great, thank you. So we have a few questions asking about how you find research opportunities, shadowing opportunities, and also someone asked your thoughts on step one being pass fail in the same question. So that's kind of completely separate, but I'll throw that in there as well.
So I guess we have to separate this like undergrad and med school. I think the research opportunities is the same for both. I think if you're just interested in doing research with a specific physician or a PI and you've read some of their papers, for example, I've always been a big proponent of just emailing them. A lot of times the papers that you read online will have like a contact email, and you can just reach out and say, hey, I'm interested in XYZ, or hey, I'd love to learn more about XYZ. You can also reach out to people you know who run labs and just say, hey, I would love to learn more about your lab and you know, that sort of thing. I wouldn't necessarily ask if they have you know, positions available like right off the bat. I think it's important to like get to know them first, or like schedule a call to like just have a conversation. And then you can always follow up with that later. But other things I'll say is like, at least for me in undergrad, there was like a whole office dedicated to research. It was like the Center for Undergraduate Research and Fellowships that literally had like a list of thousands of research opportunities at Penn that people could like get involved with. Like as Penn students, like undergrads, you were able to just like apply to them and then like hopefully get in. So like I went through the cold calling method, but like I had a lot of friends who went through that sort of those like platforms of like people literally just put up their research opportunities and want students to come. And they literally, at least for me, it said like, I want a first year undergrad or a second year undergrad to come into this lab. So, or come work on this clinical study, or come do history research or whatever, or come to, you know, I don't know, go abroad and do like an archaeological dig. Like there's so much different types of research out there, but so that's always available. And so in med school, we also have that for our summer research projects. There was a whole form that was sent out with like hundreds of research opportunities, and there's only 100 of us, so everyone was able to get one. That's always available. Shadowing, that's like honestly easier to get involved with. You can just reach out to someone and say, hey, I'm interested in like seeing your practice, or like, hey, I'd love to learn more about what you do. Is there any way I can shadow you at some point? And like I would say like 90% of the time they'll say yes, like excluding like, you know, maybe some surgical subspecialties where it's like you might not be able to get into the OR. Like I think it's very easy to get involved with shadowing. And we do it in undergrad, or we did it in undergrad, and we're doing it again in med school, just asking, talking to people. I think that's the most important thing.
Awesome. Sorry. Go ahead. Sorry.
Sorry. No, I was just gonna say I totally agree with everything that Jared said. For me, getting into my gap year research, I reached out to Dr. Langer and I shadowed him for a bit, and then I asked him, you know, what kind of thing I could do in my gap year, and he sent me to Buffalo because he did his fellowship there. So just reaching out to people within your health network. Because even in undergrad, when I was at Hofstra, you're still a part of Northwell. And so the physicians are happy to have you. And in terms of step one being pass fail, I think that I think in the first couple years, people maybe were taking it less seriously, and so the foul rate went up. That's what I hear, like by word of mouth. It's not that I've actually checked that online. And also the implication of it being pass fail is that since there's no scores anymore, you have to do more research if you want to make yourself stand out. And so research is becoming abundantly important. It's almost the only thing that distinguishes everyone from each other for these really competitive specialties like neurosurgery. So that's my opinion on it.
Awesome. Thank you guys. So next question for you both. Would you recommend a gap year as a way to gain experience, and what do you think are the main benefits?
I think it is totally context dependent. I would definitely recommend it. I took the gap year. I think there's a bunch of reasons people take gap years. I think one reason would be they just need time off. That's fine. I think med school is it's a long journey. So, you know, if you want to go travel or just like hang out, like work a job, like that's totally fine. So a lot of people do that. Some people don't want to go straight through and continue with school. For me, my big thing was I didn't want to take the MCAT my junior year, so I ended up taking it my senior year. And if you take your MCAT your senior year, then you have to apply. Like technically, I took it like second semester senior year, so you have to apply in the next cycle. So I was sort of like in that position of I had to take the gap year because I took the MCAT at a later time. I didn't really want to have to deal with the MCAT and organic chemistry and COVID-19, shutting us in our rooms. Like it was just there was just a lot going on. I made the decision to push the MCAT to my last semester of senior year, and that just meant I had to take a gap year. But that being said, I was able to get really good work experience working at a pharmaceutical company. I worked in a lab, effectively doing the same thing I did, in my academic lab. Pharmaceutical companies pay a little bit more. And I lived at home, which was really nice for me too. So I didn't actually have to pay rent. So all of it was sort of like financially, it made a lot of sense for me to do that, save some money, put some money away. And I got really good work experience. I got, a pretty unique experience. I think like being able to work for a pharmaceutical company was something that, and learn about drug design and drug delivery processes was something that I think gave me a niche edge when I was applying to med school. And I was able to talk a little bit about that. I had the sort of academic and the private side of things. I think for other people taking gap years, like some people take it because they need to check off more boxes. I had a lot of friends who didn't have any clinical experience and decided their senior year they wanted to apply to med school, and they needed to take a year to volunteer at a hospital and really make sure that was what they needed. Wanted to engage in research and do that sort of thing. Perhaps they wanted to go live in a different city. So there's 100 different reasons people take gap years now. The only thing I'll say is 80% of people take gap years now. I think maybe like around that 70 to 80. So it is not uncommon. Like I took one gap year and I still think that's uncommon. I think most people are taking like 2 now. Don't feel bad if you take a gap year. I really enjoyed it. I actually found it like a really not, even though I was working a 40, 50 hour job week, like I like relaxed and I enjoyed my time. And, it was nice getting paid too. Like Brianna said, like, I would highly encourage you to look for like paid positions. Obviously, like you might have to volunteer at a hospital on the side, but definitely doing something paid. So for me, I would definitely encourage the gap year. But if you're ready to apply and you got the stats to do it, and your MCAT's done by the time you're ready to go, then go for it. Like it does not hurt. Like you should definitely do that if that's what you want.
Yeah, honestly, I totally agree. I don't have much to add. I would just say, like, yeah, like Jared said, almost everyone takes a gap year. There's not many people in our class who go into medical school at 22, besides like the 4+4s and a handful of people. Most people are taking 1 to, I don't know, what's the most that anyone in our class has taken? Like 10? Like people have, like
30,
people are
40-year-old.
lawyers. What?
I see. Yeah, we have like a 38-year-old, a 39-year-old,
Yeah.
some
Yeah,
older.
people have completely different even careers before they start here. So if you need to take a gap year, it's honestly completely normal.
Great. Thank you guys. Next up for you, someone asks that despite being dependent on where the medical school is located in proximity to clinics for rotations, but do medical students often have cars to get from places, and is it recommended to have a car?
Yeah, like in our school, I don't really know anyone who doesn't have a car. There maybe are some people who are roommates and they carpool, but like on Long Island, there's not good, public transport besides the Long Island Railroad, which takes you, between long distances. But I would say, yeah, you pretty much need a car. Yeah.
I think it's like a requirement at most schools that you have a car, or you have to look like, I know for me, like when I think like Jefferson down in Philly, for example, like that's in the city, but they required like in your 3rd year when you do rotations, you need a car or something like that. For us, we needed it for our 1st year because we do our rotations right away. But then again, like if you go to school in Manhattan, for example, like I can't imagine they're gonna make you have a car, like you don't drive in Manhattan. So I think it really is like entirely location dependent. And most schools will work with you too. Like it is not easy to find a car. Like I had to lease a car like going into school, and that was, you gotta shop around, you gotta find the best rates and all that stuff. So you know, they understand if it like takes a little time, like they're not gonna like kick you out of school if you don't have a car on day 1, but they give you like a 2-month grace period. At least at Zucker they did, like for us to finish CPR, which is our first course that we took. So yeah.
Okay, awesome. So someone has asked how you finance your medical school and how you have dealt with the cost of medical school.
So for me, I was pretty lucky because Hofstra gave great scholarships for undergrad. So I didn't actually have any expenses in undergrad. because of Hofstra scholarships and also because of outside scholarships that I applied for. There are so many outside scholarships for the most niche things. Like the one I've gotten one like for like 4 years in a row now, that's for children of food workers, because my dad works at a pasta company. There's just like so many scholarships. So I would do like look online for scholarships that you can apply for and just apply, because a lot of people you think you might not get them, but a lot of people don't know about them. So outside scholarships were big for me. For medical school, I Hofstra did give me like a partial scholarship, and I think most people get a partial scholarship. I don't know if anyone doesn't get a scholarship. Hofstra med school is very good about helping. And the rest of it, I'm using money from my gap year and outside scholarships as well to help me get through this.
Yeah, Hofstra's very good at giving money. That again is obviously, I think like they're good in terms of like a lot of students get access to it. There are students I know who don't have scholarships at all, but for the most part, students are able to get it. I think what's nice about Hofstra is they're not only a needs-based. I think almost every med school has a needs-based financial aid program, but at Hofstra they also have a merit-based aid built in as well, so they take that into account too. And so for me, the scholarship is a big thing. The money I saved from my gap years and during my jobs in college. And then I also took out some loans as well. So that's something that was available. We get also offered a institutional loan with a much lower interest rate than the federal government. I actually declined that. We're not going into the money managing of loans, but loans are an option to all students. I actually think that's an important point, is that even if you can't afford your medical school education, you can take out federal loans up to the maximum cost of attendance. Obviously, that means you're going to have to pay them off like down the road. So that's something to consider. But there's a lot of forgiveness programs. Public service loan forgiveness is something that I'm looking to go for, which is like if you work at a hospital for 10 years, including your residency, then it all goes bye-bye. Whatever's left on your loan. So my point is, like, don't get scared like if you don't have the capital to pay for medical school, because you can take out, albeit loans are scary, but you can finance your education like entirely and get money to the cost of attendance. So like able to pay rent, things like that. So yeah, it's a mix for me. I mixed and matched. So yeah, and outside scholarships are great. I'm a big fan. I did them in college. And don't look, it's nice to look for like the $50,000 scholarships, but those are like nearly impossible to get. For me, like the outside scholarships I got a couple like $1,000 scholarships here and there. Like they're just like small things that you can just apply to, your education. So it's nice, and you should definitely look into them.
Great. Thank you guys so much for sharing that. Another question that we have for you, what else can med students do to get research experience besides MS1 summer research experience?
For neurosurgery and for a lot of the surgical specialties, you're going to be doing research pretty much your whole time in med school, because it is so competitive. So reaching out to the physicians early that you're interested in their field, pretty much from maybe like after the first block of medical school, a lot of people started research here. And yeah, same principles apply, just reaching out, cold calling, cold emailing. And if you're a medical student in their health network, I don't know why they would say no, especially if they have projects that you can help with.
Yeah, I definitely agree. I think the advice is don't start right away. Like get used to being a med student first. I think that's super important. I think like for me, like I got involved in like November, December-ish. That's when I really started getting involved with the department. But then again, like I know people who apply into neurosurgery that don't get involved into their third year. So it really depends on like who you are. I would recommend, if you know what you want to do, get started with research early. But and clinical research, like it's not like you're going anywhere. Like you're doing it from your laptop. Like you can do an hour here and there. It doesn't take like a crazy amount of time. So yeah.
Okay, awesome. Thank you. Someone asked, what are the most important skills you learned during undergrad?
Probably studying how to study, finding something that works for you, because a lot of people do take the same study habits into medical school. Like we were talking about before, research skills also hugely important and will help you a lot in medical school if you already know them from undergrad or from your gap year. Other things maybe like how to network, how to write good emails, how to talk to people that you don't know. And I know that COVID kind of like made things very weird for a lot of us, like in high school and college, and everything. But yeah, I would say that just learning those things, like how to reach out to people, is very important.
Yeah, I would definitely ditto what Brianna said. The other thing I'll say is learning how to have a work-life balance, like actually learning how to like make your schedule, so that you can make time for friends and family and going and hanging out and blah, blah, all that stuff. Because like it is so easy to just work all day, every day and like get bogged down with that. Like there's always things to be done, but like take care of yourself, like take care of your mental health, your physical health, like your social health. I think all that stuff is very important. And I'm glad I had a nice time in college, like balancing that. I think I learned it very well in college, and I brought that with me into medical school. So I have a good work-life balance here as well. So that's a very important skill. In addition to the ones Brianna talked about, I think it's very important.
Amazing. Thank you guys. So someone has asked if you ever had any second thoughts or any other paths that you were considering after college.
I don't think so. For me, like it never changed. I was always planning to apply to medical school. I think the big thing I was teetering between was whether I was going to go MD, PhD or MD. For those that don't know, MD, PhD is an 8-year track where you actually get both degrees. And you do research for like 3 to 4 years between your second and third years of medical school. I didn't end up doing that because I didn't want to do research for 4 years. And I wanted to get into residency as soon as possible. But no, I didn't really have any other career options. Yeah, I think that was it.
Once I committed to medicine, I wasn't teetering, but in high school I was thinking about it, going into music, because I play the oboe and I almost wanted to become like an orchestra musician. But that's also a hard, like medicine takes a lot of your time, but music takes a lot of your time too, being a professional musician. So I wound up choosing medicine, but yeah, no, once I got into the 4+4, I didn't really think about doing anything else.
Okay, awesome. Thank you. Someone has asked, is clinical research just comprised of analyzing data and statistics, or have you ever been able to run or witness a drug or treatment trial?
Yeah, that's a good question. It's both. So I'm actually involved in a clinical trial right now, for our department of neurosurgery. So that's me actually engaging the patients and like talking, like being there for the cases, things like that. I know Lenox Hill does a ton of clinical trials. I'm sure you guys, Chrissy and Samantha know. I think that's definitely a big part of it. The only caveat being like for medical students, like one of the readouts is you want to look to get published on things, and clinical trials take a long time. They're not quick. So, doing retrospective chart reviews and prospective studies, things like that, are a good way to like keep the ground flowing, but it's also really great to get involved with clinical trials. And those are definitely available to students, and you can definitely get your hands dirty with those as well.
I totally agree. Nothing to add.
Awesome. Well, if you guys want, we can do like one more question, or you can just give our brain turns some final advice and parting words. It's up to you guys. We have Dr. D'Amico up next, and he hasn't popped on yet. So if you want to do one more question, we do probably have time for that until he pops on.
Yes, Dr. D'Amico is actually in the middle of a case and he is not done. So we do have time for one more question, and then we'll be signing off early. Don't hop off now because we have a few things to review before you guys go for the day.
Okay, great. So the last question that we have for you guys is, how has the process of becoming certified as an EMT been? And if you could talk a little bit about it and also where you do your shifts as an EMT.
Yeah. So the process is for us as medical students, we actually did all of our certifications together as students. So we weren't like intertwined with like other EMT trainees. It was like us working together, like learning the skills, sitting for our exams, that sort of thing. It was 8 weeks, so they spread it out over 8 weeks. We did a lot of like each week learning the new skills. We do 2 12-hour we do a couple 12-hour shifts. For us, we were required to get 10 patient encounters. So some people it could take 2 if you were in a, it was a busy day. Some people could take, I think the most I heard was like 4 or 5 if it was really slow. So those are really great. For us, we do them all in Nassau County through Northwell Health. But a lot of the students, including myself, we do the Northwell buses, like the Northwell ambulances that operate through FDNY. So they cover Queens. And the Northwell ambulances also cover Lenox Hill and Lenox Hill, Greenwich as well, Greenwich Village. So that is an option to students, but I did mine in Queens, and I got like 7 calls my first day and then like 6 the next time. So it was really busy. Saw some really crazy things and some not so crazy things. It's really good training. It's a really good experience. For us, we get certified, which is really nice, and then you can do with it what you want. For me, I did nothing with it. I just have the certification and I get my 10% discounts at Lululemon and things like that. And then other than that, you get there are students in our class that decide to take their EMT certs and actually work part-time and like make money. So that's available to students as well. Especially this summer, I have a lot of friends who were doing that. So if you want to continue with it, you totally can. Brianna.
Yeah, I mean, I agree. I would say that the one thing also is that it was so fun to get EMT trained in our first few weeks, like all coming to school in our EMT uniforms and not, being in the books completely right away was a good time. I don't know if any other medical schools do the EMT training. And so I think it was a really good thing that Hofstra's doing that we do that right away.
Awesome. Well, thank you guys so much for taking the time to come back and talk to all of our brain turns today. If you have any parting words or final advice for them, I'm sure they would be very appreciative. And if we could say thank you to Jared and Brianna for talking to us today, we really appreciate it.
Yeah, parting words, I would just say, work hard, reach out if, I'm sure anyone at Northwell would be happy to have you, like shadow or answer questions. You can reach out to us. Should we put our emails in the chat? Is that something we should do or no?
Yeah, if you want to share your emails, you can put them in the chat. I know our students appreciate it when you guys share contact info, so thank you for that.
Okay.
Yeah, my parting words would be stay curious. Obviously, you're all here on this BRAINterns, 2-week seminar extravaganza for a reason. And I think it's because you share this curiosity in medicine and in neurosurgery and things like that. And so stay curious, keep plugging away and working hard, but also like stay true to yourself, do the things you love, make time for your friends and family, take care of your mental and physical health. So we'll leave it at that.
Thank you guys so much.
Thank you. It was a good time.
Take care, everyone.
Bye.
Bye, Jared. Bye, Brianna. All right, you guys. So like I said, Dr. D'Amico is in the middle of a neurosurgical procedure and is not able to leave the OR. So he will not be able to give his presentation today. He was going to do another virtual OR. If you missed his first virtual OR, it is posted to the Lenox Hill Neurosurgery YouTube channel. Again, I'm having issues logging into the BRAINterns YouTube channel, but I have access to the Lenox Hill Neurosurgery YouTube channel. So there is a playlist dedicated to this summer's webinars. I will upload today's talks to the YouTube channel this afternoon. And then if you are wondering if your design was selected for the t-shirt design contest, check out our Instagram, our threads, and our LinkedIn this afternoon around 3 o'clock. I will be posting our 4 finalists that you can vote on in the comment section. And then we will announce the winning design on Friday, July 19th. I will also be sharing the link to download your certificate on Friday, July 19th. You will not get that link until Friday, July 19th. So hang tight on that. And then for tomorrow, I'm just going to share my screen so you can see the schedule for tomorrow. So we were talking about research today, and I think tomorrow's going to be a great day because we have 2 of our friends from I gotta just double check the acronym. It is Neurosurgery Education and Research Virtual Experience Group, NERV. And they're going to talk about ways that you can engage in research outside of your school or institution through NERV. And then we also have a neuromonitoring presentation by our neurophysiologist here at Lenox Hill Hospital, Dr. Justin Silverstein. And then we also have a pediatric virtual OR with Dr. Sean Rogers from Cohen's Children's Hospital. So we're really excited to have him there. And I hope you all have a wonderful rest of your day. Thank you, Christy and Samantha, for being our superstar moderators. You guys are doing an amazing job.
Thanks,
Thank
everyone.
you.
Tomorrow.
Take care, everybody.